but my name is Just Jennifer Beauty. If anyone is joining, can you please give me a thumbs up? Let me know if you can hear me. Otherwise, Instagram is playing a nasty trick on me today. Woohoo! We got sound! Okay, thanks so much, guys. Sorry about that. Okay, so I'm going to talk to you about anti-aging. So, aging skin presents in certain ways. Fine lines and wrinkles we all know and love. You've got your skin can not retain as much moisture as it used to. By the way, not all of these are applicable to everyone, but these are just the signs that you would see. Pigmentation, so some people call it age spots. So that would be discoloration of the skin in certain areas. You've got sagging and lax skin, so skin that's not very bouncy anymore, kind of sagging jowls, and everything's starting to drop. And so what I'm going to do is I am going to do a bit of a routine whilst I talk to you, so you get to see what an anti-aging routine would look like, as well as learning a bit about what you can do to minimise or slow down aging and why aging happens. Okay, so we've got three sections to the top layer of the skin. So you've got the epidermis, the dermis, and the hypodermis. Epidermis is just layers of dead skin cells, gorgeous, and it protects the skin. It's like the defense line of the skin. Okay, it keeps bacteria out, or helps to keep bacteria out, helps keep water in, helps keep the moisture in. The dermis is where your hair follicles are, your oil glands. Most importantly, it's where your collagen and elastin sits. I'm just going to cleanse my skin whilst I'm talking to you, okay? So this is where the collagen and elastin sits. And this is where you want your anti-aging products to be able to get to, into that deeper layer of the skin. Now, elastin and collagen are like the scaffolding, like the building blocks of the skin. It keeps its structure. And by the way, if anyone's got any questions, just drop them in the comments box if you're live or if you're watching this back as a replay. So as we get older, and this is quite a scary, horrible fact, from the age of 21, we produce 2% less collagen every single year, which just scares me. So what we need to focus on is telling our body to produce more collagen for us, because that is going to keep the skin bouncy, keep it firm, keep it structured, and help reduce those appearance of wrinkles. Okay. So the hypodermis is the area where it's all fatty tissue, and as we age, that fatty tissue reduces, and so that's where you get sort of, in the eye area, you can get more pitting in the eyes here, as just an example. Also, if you have dramatic weight loss, you will find that you will have saggy skin because of the fat tissue has decreased in the face as well, okay? Right, so there are a few things that cause wrinkles. 4 things. So genetics and what I've just explained. Environmental factors, so UV rays, and I always bang on about UV rays. If you watch me and follow me, you'll know I'm always going on about UVA rays, UVB rays. So UVA rays, they are the silent assassins that come out even when the sun isn't out. They can penetrate through windows and they go deeper into the layers of the skin, and they will kill off the collagen. So that is why it is so important to wear SPF, a broad spectrum SPF, every day and top it up throughout the day, because it doesn't matter how good your skincare routine is, how many treatments you have, if you're not using SPF religiously, you are going to be killing off that collagen that's already depleting. So what I'm doing here is I'm just cleansing the skin. I'm using a balm to oil cleanser, so it's got a bit of a gritty texture to it, and it's going to melt into an oil, and this gives me a double cleanse, and it exfoliates the top layer of the skin for me really gently, because when I use my anti-aging mask, I want all of those dead skin cells to have been gone, so that the mask can penetrate through the skin and get to where it needs to go, to where that collagen sits. I always say you wouldn't polish a dirty car. No point. You clean the car first and then you can polish the car. So that's exactly what I'm doing here. Where was I? Oh yes, what causes wrinkles? Facial expressions. So when we smile, when we frown, you know, when we raise our eyebrows, our facial expressions cause a crease in the skin. And as we do that more and more, we get resting lines. Okay, so that is another thing that causes wrinkles. I am going to put a list of all of the products on afterwards, just so that I'm not going through shouting out products all the time. I'll put a list in the comments, or if you type the word live into the comments, then you can get direct access to me after the live, where I can help you with any skin specific questions or product questions. Okay, so what we want to do with our skin is keep it hydrated, and that is through moisturization or through, I'm just pouring water all over my lap here, that's just terrible, I'm soaked. So what we want to do is we want to hydrate the skin, obviously through drinking water. You need to drink enough water, but also through our skincare products. So your moisturizer and also your serums will most likely be packed full of things that are going to hydrate your skin, some ceramides and some hyaluronic acid. Really, you don't need a separate hyaluronic acid serum because it's such a common skincare ingredient now that it is in most products. Okay, so I'm just going to remove this. Now, how do we produce more collagen? The absolute hero is retinoids, okay? They will tell the body to produce more collagen. They will also exfoliate the skin. So when we're babies, our skin cell turnover, and what I mean by that is, let me just get that off my nose. What I mean by that is, we've got layers of skin, and you've got the new baby skin cells down here, and as you are going up the layers of the skin, they become flattened, they start to lose the moisture, they become dead skin cells, and they sit on the surface until they fall off. When we're babies, that skin cell turnover happens every week, every few days, every week. That's why the skin is so soft and gorgeous. But as we get older, it's every month, every couple of months, every few months. And that's when your face starts to look dull. And it has that rough texture, and it's literally layers of dead skin cells that are just sat on the surface of the skin. So what happens is the glue that holds on to those dead skin cells is, it takes longer to break down. So what we want to do is, using a retinol, it will break down that glue so that our skin cells can fall away quicker. Excuse me, just choking. So that's why some people will say, you may have heard people say, retinol thins your skin. It doesn't. It thins the top layer of the dead skin cells, okay? So retinol is really, really good product to use. There are different strengths and different types of retinol. If you want advice on retinol specifically, just pop me a message after the live, okay? Then you've got things like peptides, okay? Peptides, usually in serums, in masks, in moisturizers, and they will also tell the body to produce more collagen. So you see where I'm getting to here. It's all about telling the body to produce more collagen. Now, someone did ask me earlier, what are my thoughts on collagen supplements? The jury is out on supplements, okay? Collagen is a protein, and it is made up of a long amino acid chain. And taking collagen supplements, I haven't yet seen any proper scientific evidence to say that our body, oh God, I've got a cat up here now as well, to say that our bodies can digest the collagen supplements efficiently enough to be able to reuse them. So really what we want to do in terms of skincare is topically be using peptides and retinoids, or there are certain treatments that you can have that will make your body produce more collagen. So things like microneedling, and what that does is it causes very superficial damage to the skin. So of course it's a little needle, you must have it done professionally, don't do it at home. Little needle that causes little wounds in the skin, and when your skin is injured or has a wound, it produces more collagen to help repair. And so that is a way of helping to boost collagen. So there are certain treatments that you can have, like also laser therapy as well, and light therapy. What mask am I using? I am using a Truffles Gold mask, which is full of peptides. It's got diamond extracts in it. It's got gold extracts. What it does is it gives you instant radiance. It tells your body to produce more collagen, and it firms the skin. Really good mask. I do this once a week, and it boosts hydration, gives you that instant glow. Okay. So, LED light therapy. Let's talk about that really quickly. Here's one I've got. Oh, this, you can now get LED masks at home. LED therapy has been used by dermatologists for years and years, and there are different light frequencies that help with different things, and red will help with anti-aging. So if anyone again wants any recommendations for those, I can give you some. They are expensive. They will be about £400, but they do work. They are great. You can get ones that help with hyperpigmentation, and you can get ones that help with acne as well. And they are fantastic, and you'd use them for about anywhere, depending on which one you use, anywhere between 5 and 15 minutes every day. Just sit there in the evening and scare your partner or scare your friend or scare your cat. But they are really good. I use mine, absolutely love it. So with pigmentation occurs with aging skin because, melanocytes produce melanin, and melanin is what gives us our colour. Like, I've just been on holiday, so I'm tanned, I've got lots of melanin. Lots of people say, oh, you've got fabulous tan, it's wonderful, but actually melanin is produced because it is trying to defend the skin against the UVB rays. And so really it's just saying, oh, you're really damaged, but looks nice. So you can tell I'm a bit hyper today, aren't you? I'm not my usual self, guys. I had too many cups of tea. So what melanin does as we age is the melanocytes become a bit damaged, and usually that is either down to hormone imbalance or previous skin damage from the sun. And what happens is the melanocytes just shoot out randomly bits of melanin. So that's why you can suddenly get a little area on the skin that comes up with a darker patch, and you're like, well, what is that? What's happened? And that is hyperpigmentation. So there are a few things that we can do for that as well. Again, SPF, absolute must, because if you've got damage like that to the skin, the sun is only going to make it worse, okay? So there are certain things you can use. You need to exfoliate the skin, exfoliate regularly. You can either use a manual exfoliant like a face scrub or a sonic cleansing brush, or you can use a chemical exfoliant. And a chemical exfoliant, not scary at all, might sound it, but it's not. It is just basically a liquid, and I'm going to show you on my hand. It is a liquid that has fruit acids, maybe some lactic acid, might have glycolic acid in it. But basically what it does is it goes onto the surface of the skin and it will nibble away at the dead skin cells. So the melanin actually sits in the dead skin cells. So that's what you want to be getting rid of, okay? And what this does is this reacts with the oxygen in the air and reacts with the natural moisture in your skin, and it will just bubble away and foam and just nibble away at the dead skin cells, at the glue that's holding on to the dead skin, and that will help to even out your skin tone, helps even out your skin texture and give you more of an even skin tone. Once you've applied this, you literally leave it for about 5 minutes and then wash off with a cloth. And then you need to apply your vitamin C serum, okay? So vitamin C, if it is mixed with a triactive acid, and again, if anyone's got any questions about these, just message me after the live and I can talk to you about individual products. Just note down what you need help with. if it's mixed with a triactive acid, what it does is it will go and find the areas of the skin that are darker and inhibit the melanin from coming through. So it will just be like, nah, you gotta stay back there. And that is treating the baby skin cells lower down. So this one is treating the dead skin cells on the top where it's currently showing, and a serum is going to go deep down to the new skin cells and teach them how to be uniform and perfect. So by the time they come up to the surface of the skin, they are looking gorgeous. So what I always say, people ask, you know, how long does it take for retinol for you to see a difference with retinol with skincare? Always give it about 1 to 2 months before you see any difference. There are some products that you will have immediate results with, and that's great. But if you just think of what I've just said, that some products will treat the surface of the skin and some will treat deeper down. Usually if your skin cell turnover is about 28 days, you're not going to see those new healthy skin cells until 28 days later. And sometimes you need a bit longer for that serum or the treatment to do its work on a few of the layers of the new baby skin cells. So give it about 1 to 2 months. If you're really not seeing any difference, then probably that product isn't for you, or you might be using it in a slightly incorrect way or an incorrect order. I'm going to take this mask off now, otherwise I will be here forever. So with this mask, you can do a really quick 5-minute express treatment, or you can leave it on for about half an hour, okay? I always say if you're using a new product like this, like a mask is your treatment, so it's going to be like once a week that you would do something like this. But the first time you use it, you'd never just go straight in with a half an hour. So I say, if you're going to run a marathon and you've never run one before, you don't just turn up at the start line, do you? You start training your body for it, and it's exactly the same with the skin. You don't want to overload the skin. You just want to ease it in. It's a bit like retinol as well. Does anyone currently use retinol? And how do you get on with it? Does it affect your skin? Do you get irritated, dry, red, flaky? Any of those? Let me know. Okay, so now I've taken this off. I got it all off. Yes. So you can see that mask that I've just put on my hand is foaming up, and that will just bubble away and go to nothing. It's a fantastic mask, and it means that you don't get any of that friction irritation that you can do with a face scrub. So if you've got more sensitive skin, this would be the way to exfoliate rather than using a face scrub. Now I am just going to use my niacinamide toner. So I'm just going to balance out the pH level of the skin. I'm just going to answer Laura here. Using retinol pads, very dry and flaky, so only use once or twice a week. Laura, what you need to do, so guys, if you are using retinol and it irritates your skin, first of all, just check that you're not using too high a percentage. A retinol that is encapsulated, it will still look like a serum, but it releases slower into the skin. So it means it's less irritating. And if you are still having irritating effects, then use what we call the sandwich effect, which is where you get your moisturizer, you put a tiny bit on your face, and then you apply your retinol, and then you apply your normal amount of moisturizer on top, and that will just sandwich the retinol and take away those irritating, drying and flaky effects that retinol has. Yeah, retinol can also make you break out as well. It's called purging. See it in a positive light. Can I just say, after I've cleansed my skin and done a mask, I've used my toner, and that's how much dirt it's still picked up from my skin. So that is why using a toner is extremely good to do. So what was I saying? Started using retinol, bit of breakout. Yeah, take breakouts like that to be a positive, because what it is it's purging, and it's just kicking out all of the bacteria and the grime that is stuck in the deeper layers of the skin that would have later on become a breakout. So you're just flushing everything out. if a purge can last up to 6 weeks, unfortunately. But if it lasts any longer than that, or if it becomes stingy or irritated, then usually that's probably that the product is not actually right for your skin. Okay, so yes, so I use my niacinamide toner to get rid of any of the dirt that was left behind in the pores, but also niacinamide is a nice anti-aging product as well. It's slightly anti-aging. What it does is it strengthens the skin barrier, so that top layer of the skin that protects the skin, just to make sure that there's no sort of holes in the defense. When there's holes in the defense, your skin can't hold on to moisture. Yes, the video will be saved, Helen. Your skin can't hold on to moisture. You become more prone to sun damage. Niacinamide calms the skin as well. It soothes the skin, and it helps to regulate your skin's oil production. So it's all round a good product to use. So you can see this is still foaming down. So next I am going to use my I'm going to use my eye cream. Eye cream. How many people use a face cream as their eye cream? Or do you all use a separate eye cream to face cream? Please tell me you use a separate eye cream to face cream. So literally, that's how much you need. I'm going to tell you why in just a second. Transfer your eye cream onto your ring fingers. Reason why your ring fingers is because these are the weakest fingers on your hands, and the eye area needs really gentle touch. So I am putting it all around my orbital bone, and then I'm tapping. I'm not sweeping, I'm not dragging. Well done, guys, separate eye creams coming through, I love it. I'm not dragging the skin. If you sweep, you're going to cause premature wrinkles, and the eye area is too delicate, okay? Rachel, I love that you're using a Temple Spa eye cream. 5 stars. Okay, so under eyes, sometimes you can get puffy under eyes, under eye bags, and usually that is down to fluid retention in that area. So once you have put your eye cream on, what I'd like you to do is pat and move the skin. You're going to take it back to the lymph nodes, okay? So you're just going to pat, you're not going to drag, you're going to pat, and you're just going to collect that fluid and start to move it back to the lymph nodes, because that is where we collect our fluid, okay? If you want an instant eye lift feeling, pinch your fingers. This is really good for if you've got hooded eyes as well. And you're just gonna, let me make sure you can see that. You're gonna pinch, you're gonna put firm pressure underneath, and then you're gonna pinch. Like this. And that is just gonna help lift the skin, okay? Can you see the difference? I'm going to do this one as well. So with an eye cream, you can get dark circles, you can get fine lines, you can get wrinkles, you can get sunken eyes. So if you've got if you suffer from dark circles, ow, just hit my elbow. If you suffer from dark circles, you have to I want you to do this test really gently. Just pick up the skin and just lift it and look in the mirror. Does the skin, when you lift it, stay dark, that darker colour, or does it go back to a normal colour? If it stays dark, then it means the pigment in your skin has gone darker, so you need to use an eye cream that is going to lighten the skin. If, when you lift the skin, the skin comes back a normal colour, it means that you need to build up the collagen and the tissue under the skin, because the skin's thinned and you're actually seeing blood vessels and things underneath the skin. So that will determine which is the best eye cream for you to use. Okay, it's different types of dark circles. So if you do that test and you want any help, just send me a message privately and I can give you recommendations. Okay, are you supposed to apply so eye cream, depends what is in your eye cream. If you've got retinol in your eye cream, try not to place it on the eyelids because it can be a bit too irritating. What I tend to do is tap all of the product into the skin, and then you've just got a bit of residual product on your hands. I just place it over my eyes just very gently like that, just to keep them nicely fresh and hydrated. Okay, so the reason why I do an eye cream before your serum is because serums are targeted, concentrated liquids that are quite powerful, that are aimed to go deep into the layers of the skin and treat your primary skin concerns. So I did a post, I think yesterday, about realising what your skin concerns are. So if you haven't seen that, go back and have a look at it. But it will give you a really clear idea as to a list of what your skin concerns are, and then you will know what is your biggest skin concern that you want to tackle. When you know that, treat it with your serum, okay? So this is a firming serum, and yeah, my live is going to be saved for everyone who's asking. So this is a firming serum, and what this does exactly what I've said. It firms the skin. It will also help to reduce those fine lines and wrinkles. It will hydrate the skin as well. And so it's full of peptides, which again, if any of you are late to joining, peptides, sorry, my door's just gone. It's always the way, isn't it? Peptides will tell your body to produce more collagen and elastin. Okay, now what I'm going to do is apply my moisturiser. I'm not going to apply an SPF just yet, but normally I would, okay? So my moisturiser is, again, an anti-aging moisturiser. It is full of antioxidants. This has Happy Bell peptide in it, which is fantastic. Happy Bell peptide is a peptide that gives that has us release the hormone of just got good news. So, you know, like if you find a new partner and you're really happy, or you're pregnant, or you just got a new job and you're ecstatic, something really good has happened, you've had some really good news, your body releases an endorphin that gives you that glow, and that's why people say, oh my gosh, you're glowing. Sorry, my door. Oh my gosh, you're glowing. That's what Happy Bell peptide does, and can you see? It's just given me that instant radiant glow. I mean, I can see the difference. I hope you can too. So there are a few little techniques that you can do when you've got a nice good slip on your face. So usually with a serum or with the cleanser that I used in the beginning. That cleanser, I'm a skincare specialist, so I do facials and I do face reflexology. I can do an hour's face massage using a pea size of that cleanser. It goes so far, it's fantastic. So, gels. So first of all, I want to talk about the chin. So what you want to do is you want to put your thumb under your chin and go, it's going to be hard for me to talk, guys, and go up towards the ears, okay? And what we're doing here is we're going to do a bit of lymphatic drainage, and that is just going to help with any puffiness in the skin, and we're also going to lift the skin. We're going to give ourselves a bit of a lift. So we're going to lift under here, and then we're going to take our knuckles, quite a firm pressure, and always go to the ear. You can see. And then quite often we've got lines here, so you want to go up, just pushing the whole skin up. And then you want to go across the line, so you want to break through the line, so you can go back and forth. Make sure you do have a good facial oil or cleanser or a good moisturiser on, because you don't want to drag and pull the skin. I'm just going to do this quickly so it doesn't take up too much time. and then we're going to go under the cheeks, and this will help to just define our cheekbones and just lift that skin. Okay, then we're going to go up through the forehead and back down. Okay, so that's just really quickly. You can do that with your cleanser every morning, and it just really wakes you up. And also in the evening, if you've got really, really tired eyes, you've been doing a lot of work, just throw your thumbs right here, either side of your nose, and that's a really good pressure point for releasing any pressure. So next up, we're going to treat the neck. So neck, the neck actually shows signs of aging quicker because it doesn't have oil glands like we do in the face. So what I'm doing is I'm putting my neck gel on the back of my hand, and I am stroking, doing kitten kisses up my neck. And the reason why I'm doing this is because your hands also show signs of aging first. So you're treating your hands as you're treating your neck. So what this does is this product firms the skin, and also it's got red pepper extracts in it that will help your neck to produce a little bit more oil because it doesn't naturally have oil glands. But wheat protein is really good for helping lift and firm. And it will take 28 days, but you will see a huge difference in your neck. It will help with crepey necks, helps with those lines that come across the neck, and it helps with sagging skin. It is fantastic. So that is a really, really quick routine that you can do once a week. Absolutely simple. So there are other treatments that can help with anti-aging. Everybody knows about Botox. I'll just explain Botox, and it's your personal preference as to whether you have used Botox or not. But Botox will treat the fact that we are using our expressions and causing expression lines. So what that does is that a practitioner will put a needle into the muscle, and it will give a tiny bit of fluid to that muscle, which will freeze the muscle from making that movement. What it does is it stops the nerves from sending a message to the muscle to make that movement, okay? And it's not forever. It will probably last about 3 or 4 months, and then you'd need to have it done again. So that is, that's completely up to you if you want to go down that route. There are other things that can help, like microdermabrasion. And I think someone said in the comments below that they went for a facial and someone put a machine over their skin. If someone did, could you just post that again? I think that was you might be talking about microdermabrasion. So this is a vacuum suction with exfoliating head on it, and you would go over the whole skin, and what it does, it takes the top layer of the skin off, takes the dead skin cells off, helps to clear out the pores, it boosts blood circulation, and blood circulation is really important for helping with anti-aging because it gets oxygen to the skin and extra nutrients. It will help with lymphatic drainage, so help all of that puffiness, and it gives a plumping natural Botox effect. So it is a very good treatment to also use. I've mentioned LED light therapy as well. So that, I think, is my quick tips. Obviously, things like smoking, alcohol, things like that aren't going to help with aging. It kills off collagen. So if you can stay away from smoking and excessive alcohol, then that's also a good thing. If anyone's got any other questions, please just pop me a private message once I've come off of this live, and I will come back to you. I couldn't capture everybody's messages with their questions, so I'm sorry if I didn't answer your question. Pop it to me in a private message. But thank you so much for joining. I hope you found that useful. And yeah, have a lovely day. Take care.